Imagine for a moment that your hands are your thoughts and feelings. Imagine that everything you care about is surrounding you. Everything that's important to you in your life, it's all around you. But then you hold up your hands, including all of your thoughts and feelings, and then you put them over your face. And they're blocking the view of everything that surrounds you, everything that you care about. Your view becomes distorted and distracted and blocked. And this is exactly what it's like for someone that's overwhelmed with their thoughts of health anxiety and the sensations and focusing on those instead of what they care about in the world around them. Everything becomes distorted and distracted by their fearful thoughts. They begin to miss so much in their life, and they get caught up and they get hooked by their health anxiety. Living with health anxiety can feel overwhelming. It involves all kinds of worries about your health that take center stage. And when working with people with health anxiety, they describe these health concerns as just monopolizing their thoughts 24/7, to the point that it affects every aspect of their life. Health anxiety, formerly referred to as hypochondria, is diagnosed as illness anxiety disorder or somatic symptom disorder, and sometimes panic disorder. And it behaves like OCD because it creates a cycle of obsessive concerns and behaviors like reassurance seeking, body symptom checking, ruminating, excessive Googling, and then avoidance and safety behaviors. People with health anxiety and other anxiety disorders like panic disorder score high on a trait called anxiety sensitivity. Anxiety sensitivity is the belief and the misinterpretation that what you are feeling in your body due to anxiety is dangerous. Now, health anxiety can hook your attention and really reel you in. It can convince you that something is seriously wrong, and it can activate your fear response. It pulls you away from everything else. Health anxiety thrives on your vulnerabilities and catastrophic thinking, where minor symptoms can get blown out of proportion, leading to thinking of the worst case scenarios. But health anxiety is a treatable condition. Today I'm going to review how to get unhooked from catastrophic thinking and unarm those irrational health worries and help you to engage in what really matters in your life. Now, in order to do that, understand that the majority of our thoughts and feelings and emotions and sensations are outside of our control. But you can choose on how you're going to respond and what you're going to choose to focus on. That's in your control. For example, if you value spending time with your family and friends, are you choosing activities to engage with them? Or are you avoiding those activities because you're so focused on your health worries? Now, since we can't stop a thought, I'm going to share how to separate yourself from your thoughts. In ACT therapy, which is a type of CBT, we call that diffusion, and we create some space between you and your thoughts. So your goal is not to get rid of your thoughts or your anxiety. Your goal is to engage in activities in your life that are important to you, that bring you fulfillment and connection and joy and whatever it is that you want. So let's begin with the first technique, to create separation between you and your thoughts. Now, number one, when experiencing a health worry or a physical sensation, label your thoughts or sensations. Say to yourself, I'm having a thought that, and then fill in the blank. For example, I'm having a thought that I'm getting brain fog and I might not recover. I'm having a thought that my heart is racing and I might have a cardiac event. Number two, the second technique to separate you from your thoughts is to say your worry in a funny voice. I use this a lot with people with OCD and anxiety, and something happens when we give our worries a funny voice. It's almost like our brain gets the humor and it interprets, the thought as less threatening. Number 3, the third technique is similar, but it involves singing your health worries. You can sing it to a favorite tune, you can sing it to happy birthday, you can make up your own little song or rap about your health worries. Number 4, the fourth technique is to name your story. Everyone seems to have their favorite health worry stories, and they just kind of play on repeat. So give your story a wacky name, and then identify it when that story shows up. Number 5, the fifth technique is asking yourself a question. Now, you must know someone that doesn't have health anxiety. So ask yourself, what would, so-and-so do if they had this thought or they felt this sensation? Because you have health anxiety, you might jump right to that catastrophic thinking. But sometimes following how someone else without health anxiety might behave in this moment can really help you stay on track. Number 6. Now, the sixth technique is what I recommend when someone is stuck in a cycle of rumination. It's my I am technique, where I stands for identify the thought, label it like I said before. A stands for allowing it to be there, just let it float in the background. It's in your awareness. And then M stands for shifting in the moment. You're shifting to focusing your attention on something else. It's not distraction, it's just a shift in focus. And then move on with your day. Number 7, the seventh technique is especially helpful when you notice that despite your best efforts, health anxiety symptoms and worries are just there. And maybe your whole body feels uptight and anxious today. So you don't want to reinforce the anxiety by avoiding or backing away from what you have planned for the day. Instead, you want to train your brain that regardless of whether or not anxiety decides to show up today, you are going to stick to your plan. And here you just invite your anxiety to jump in and come along for the ride. So verbally, you literally do, and just invite your anxiety. Have a seat in the back, jump in the backpack, get in the purse. Let's go. In other words, you are having a welcoming and willing attitude, and you're doing what's important to you. Now, these 7 techniques help you defuse or unhook from your health anxiety thoughts while choosing to do what you want to do, to engage in what's important in your life. Now, sometimes people get hung up on, what if something really were an emergency? Paige, how do I know if there's a real health emergency? Well, first, if this comes up for you on repeat, what if this is a real emergency? But you've repeatedly gone to the ER, you've had checkups, nothing has been found, then I want you to give that a story too. Maybe you can call it your scary emergency story. But I do advise people that do have health concerns to take your list to your physician or your medical provider for an evaluation. Now, for many people that have health anxiety, they've already done that. They've typically had testing and the results were benign or normal, and it is just a result of anxiety in their body. Now, in this case, you want to agree upon a schedule of how often you should have a checkup with your medical provider, along with discussing what symptoms would constitute an emergency. Now, these scheduled checkups should be based on medical needs and recommendations, not just unnecessary appointments for reassurance seeking. It's important to tell your medical providers that you have health anxiety. It's nothing to be ashamed of. They really need to know that information so they can help you decipher what's a medical emergency versus what symptoms need to be tolerated. Now, some people with health anxiety avoid medical providers and facilities and evaluations altogether. So if you fall into that avoider category, this will be an area where you will want to work on. You'll want to work on pushing out from your comfort zone there and schedule a medical evaluation. If your health anxiety persists or significantly impairs your daily functioning, seeking help is crucial. I left you a health anxiety assessment below and have an effective, easy-to-follow health anxiety course to help you at pagepradco.com. Now, tackling health anxiety requires a proactive approach and concrete tools to really unarm those irrational worries. The 7 techniques I covered include methods of unhooking you from your health anxiety worries and sensations. So until next time, I'll see you in session. Take care. Bye-bye.